Happy New Year, everybody, and congrats to all the winners who got all the answers right. So, this is the explanation. The first one is what is the type of granuloma shown here? This is an easy diagnosis even on low power, and most of you have got this. Basically, what you're seeing is tightly packed epithelioid granulomas. What we mean by epithelioid is that these are epithelioid histiocytes which are closely arranged in small nests, and they are surrounded by a very thin mantle of lymphocytes. So when the histiocytes are numerous and lymphocytes are only few, we call this an epithelioid granuloma or a sarcoidal granuloma. This is typical of sarcoidosis. Necrobitic granuloma is usually is synonymous with palisading granuloma, and the examples of this being granuloma annulare and necrobiosis lipoidica. Tuberculoid granuloma, you basically see, it's a different type of granuloma wherein there are numerous lymphocytes and lesser number of histiocytes, and often with or without caseation type necrosis. Suppurative granuloma, there should be neutrophils, and we'll explain that later on. So what is the type of giant cell shown here? This is an easy spotter. This is a two-tone giant cell. Now the classical feature is this foamy cytoplasm, because these are lipid-rich histiocytes which have engulfed lipid and usually found in xanthomas, xanthogranulomas. So this is verified two-tone giant cells, and the typical feature is this foamy cytoplasm around a necklace, the nuclei forming a necklace. So multinucleate giant cell with the nuclei forming a necklace circle, and then you have this foamy cytoplasm around, and in the center the cytoplasm is much more amphiphilic and eosinophilic basically. Now the differential here is a foreign body giant cell. Now if you're seeing this type of giant cell here with the nuclei all overlapping with each other, but if the cytoplasm is clear, then you can think about a foreign body giant cell. This is not a foreign body giant cell because the cytoplasm is foamy. Now, if you're seeing this type of giant cell, yes, you can confuse this with a Langerhans giant cell because it's a horseshoe shaped. The nucleus is sort of horseshoe shaped, but however, the cytoplasm is again foamy. And in this context, this is a two-tone giant cell. Floret-like multinuclear giant cells are basically, giant cell fibroblasts which form giant cells, and that is not related to a granulomatous condition. You can Google that and learn about it, but it's not necessary for dermatologists as such. Now, the third question again is very easy. What is the type of granuloma shown in the picture? Now, if you look in the center, you're seeing polymorphs. Now, you can make out the polymorph because the nucleus is not a single round dot. It looks fragmented. So, these are polymorphs, and the cytoplasm is also slightly eosinophilic. Now, you'll be able to zoom on your screens, and my iPhone, I'm not able to zoom in properly, but you can easily zoom on your own screens when you answer the question, when you see the answers, when you look at the image. Now, these neutrophils are surrounded by a palisade of histiocytes. These are all histiocytes here, which are much larger, slipper-shaped nucleus. And then this is surrounded by lymphocytes at the periphery. These are the small lymphocytes with small round nuclei. The nucleus looks like a bindi, like a dot, a blue round dot with much less cytoplasm. So these are lymphocytes. These are histiocytes, and these are neutrophils. This is a suppurative granuloma. This is not a necrobiotic because there's no necrosis, and necrobiotic granulomas don't contain neutrophils. All right. So this is in fact a very easy diagnosis clinically, and I hope at least if you make the clinical diagnosis, then you'll be able to get the histology. So asymptomatic lesions on dorsal hand for 6 months, annular lesions with a sort of raised margin. This is granuloma annulare. I hope you got the diagnosis. So this is GA. Now histologically, GA should show a palisading granulomatous response. The first picture is showing a spongiotic dermatitis with parakeratosis. I hope you can make it out. And neutrophils in the stratum corneum. This is in fact tinea that I picked out. This is a histology of tinea, so you can exclude it. And the simple fact that I said asymptomatic and only on the dorsal on the right hand, no scaling clinical picture, you should exclude tinea based on that. Now, what about the second image? The second image is showing fragmented collagen bundles. Can you see that? The collagen bundles are all fragmented, broken apart, and they're also widely spaced. There's a lot of space between the collagen bundles. If you look at the center here, I'm zooming in. Now zoom in into your own on your own screen, and you'll be able to make out some granular material here right in the center. This is in fact mucin. So the spaces separating the collagen bundles are filled with mucin in this condition. and usually you have a palisade. You see the lymphocytes lining around the broken collagen bundles. So each collagen bundle is surrounded by a palisade of lymphocytes and occasional histiocyte. So here, right in the middle, is a histiocyte with a slipper-shaped nucleus, wherein the other cells are lymphocytes. So please make a note: histiocytes, the nucleus is much more paler, slipper-shaped, and lymphocytes, the nucleus is rounded and darker. Okay, so here it's not a typical granuloma. Palisading granuloma is not a typical granuloma. You just see a mixture of lymphocytes and histiocytes. Perhaps in the next quiz, I'll put up a slide of what actually constitutes a granuloma, and it is sometimes difficult to diagnose a granuloma because not all granulomas are classical. So, what actually constitutes a granuloma is presence of just a few histiocytes enough to call something a granuloma. We shall discuss that maybe in the next few quizzes. So this is the interstitial variant of granuloma annulare. This is the typical picture. In the classical variant of granuloma annulare, you see a typical palisading granuloma with central necrobiosis or necrosis of collagen. But this is the interstitial variant, and this is the classical histological picture. And in fact, in my clinical practice, I think that applies to all over India and in the subcontinent anyway. Interstitial variant of granuloma annulare is much more common histologically than the classical variant. So this is the answer. Now, talking about the remaining, now this is basically showing atrophic epidermis and lymphocytic infiltrate. This is actually, and you can see make out even LOPA, there's sort of interface vascular change. This is a clinical histological picture of lupus actually that I've put. So that is not the diagnosis. This is showing in fact a psoriasiform dermatitis epidermal hyperplasia with lymphocytes here. There's no dermis in fact, and there's marked hyperkeratosis. This is an acral skin. This is acral psoriasis that I've put a picture of, and this is not related to the clinical picture or the diagnosis. I hope the answers are clear. Thank you very much.